Unong ilam kaliang persya Dr. Mukul Sangma. Ula Kawang tinggi ya ka sorkar MDA ka balapan kala ya ka Tura Medical College ya ka Private Medical College. Haga jing sisa ya ka ni ka college larai ya ka sorkar menchwa ha ka por balong menti rongba mau bante ya ka Tura Government Medical College henre hadin balawan ka sorkar MDA ka bayalam do konrad lapan kala no ya ka Private Medical College kat ba ka Shillong Medical College lapan kala sa Government Medical College kabla rai menchwa ban longkum ka Private Medical College. U Dr. Mukul ula maham ya ka sorkar palada company ya ka rai ka ba menchwa ban pelong ya ka Tura Government Medical College kan wanra jeng persa ka bejur nagi paid ba jogeri lum garo. Halor ki jinge balapan pau ka sorkar khamtam ha ka baide ba jing su tulop. U Dr. Mukul ula om pa haba ka kam ka ka boru kan nang ula maham ba don kam ban penye seriem balada ka sorkar ka shimno ya ka bala ai kan wanra i kijing sngosi i ki paid ba bat ula benrap lada kni ya kijing Jinglehkai na Khunlung un sayam la benrap langru ki emri kentopu rupa marak kamiani shira halor kani kamat kabla wanra ru Dr. Mukul ubla kentu ya ka sorkar pakan paidin biang ya kani gerai.
Mr. Chairman, sir, under Rule 50 of the Rules of Procedure and Conduct of Business, I raised this matter to discuss about the matter relating to the decision of the government to hand over the Tura Medical College to private entity for its operation and management. The decision has led to public dissent and opposition, the opposition emanating from genuine apprehension of the negative ramification of such decision on medical education, access to affordable and quality health care, particularly to the poor and the weaker section of the people. And the fact that the issue is already causing a huge public dissent from the fact that the medical college in question is the first and the only medical college being established in Garo Hills region, wherein the investment for the whole infrastructure created is from the public exchequer, originally meant for the establishment of government medical college, with the Tura Civil Hospital as the attached teaching hospital of the government medical college under the assistance from Government of India. And the matter is of urgent public importance, and therefore I raised this short duration discussion. And this discussion, I'm confident and expect that it will give complete clarity on the pros and cons, and also guide the government in the right direction, keeping in mind the sensitivity of the case and keeping in mind the overall aspiration of the people of the state of Meghalaya and the people of Garo Hills in particular. So, Mr. Speaker, sir, I would like to draw the attention of the government on this very core issue of establishment of medical colleges, how the state grappled to find answers and ways and means. It was necessary to have medical college. We are fortunate that the government of India, in fact the nation, has a robust system to enable the aspiring students of every state, even those students who belong to states where there is no medical colleges, to have access to medical colleges to pursue their career in medical education, and enable the states to have their required doctors and serve and take care of the whole health delivery system. Meghalaya is one of the states which has benefited out of this. Mr. Chairman, you and I, from the same alma mater, RIMS, because RIMS was established by NEC, funded by MHA. That time NEC was under MHA. And because of the constraints of the states to establish medical colleges from their own fund, Government of India had to intervene and create such institutions. That is the beginning. And we are fortunate today that RIMS over the periods have evolved, have reached that level where they are providing not only undergraduate courses of studies, but also postgraduate, courtesy Regional Institute of Medical Sciences, that today Meghalaya has substantial number of specialists as well, including Mr. Chairman, sir. It is because of these institutions, of the government-run institutions. So these are the avenues and opportunities that the government institution provides, unlike anything which is run by the private or anything that is run in association with private entities. We have done exhaustive due diligence on the pros and cons of running medical institution, medical college on a PPP mode. We engage international consultant, the subsidiary of World Bank itself, to somehow structure a format which can be leveraged upon and by which we can really comprehend the challenges and difficulties and the nuances of this whole approach. And in fact, I would like to remind this August House that when this kind of fund was not yet available from Government of India, we were grappling to find sources of fund. We were knocking the door of the Government of India again and again, me being the professional from medical fraternity. I always had this dream that Meghalaya should have a number of medical colleges, including in my birthplace, Ampati. Not only in Tura, not only in Shillong, elsewhere also, in other parts. And based on that, while we were awaiting Government of India's response to the request of the state, we were quite aggressive on that. We had to look at other means. That's why the Shillong Medical College on PPP mode. I think we have to remind this August House and ourselves that how we formatted that PPP mode to establish Shillong Medical College on PPP mode, except the land of the Red Chest Hospital, nothing else, except few quantum of amount of fund as certain investment to take care of, to give effect to that kind of agreement under PPP mode. We did not allow this agreement to leverage upon our existing infrastructure. We did not link the existing hospital like to Shillong Civil Hospital or any such hospitals, so that these hospitals will remain available for us for a government medical college subsequently. It's one of the best deals that the country had ever had in as far as any initiative of the state government for establishment of medical college under PPP mode is concerned. We have ideated, we have find ways and means and how to prevail upon the likely private entity with this minimum available support from Government of India to bring investment and establish medical college on a PPP mode. The fact that it did not come to fruition is a different story. There are many reasons. I would not like to dwell on that, because then it would be a blame game. Yes, it should have been done, because it was only with that land which fulfilled the criteria in as far as the parcel of the land which is required for establishment of medical college. That time it was 25 acres of land. So Red Chest Hospital in the middle of the city, and how we can utilize that one to start one medical college. Honorable Minister in charge, Health, was there when we laid the foundation stone to kick off that initiative. And I would like to urge upon the Minister in charge to look at how we have beautifully crafted that whole, all the terms and conditions, leveraging upon our strength as a Meghalaya, as one of the most favored destinations. Then the way we convince the potential investors to partner us in this endeavor, there were many. We zeroed down on one with a proper, transparent tendering process. And somehow or other, we missed this one. But what I'm trying to say is that look at how we formatted when we talk about bringing in private entities to partner with the state to develop a medical college, to establish a medical college on PPP. Completely different. No hospital given, nothing. But at the same time, look at how many seats would have come to the states and the access to the teaching hospital in respect of treatment for all the patients who will be referred to the hospital. And therefore, now, we did not stop there. We kept on working and working. One day when we had a program which was graced by the then Honorable Union Minister Ghulam Nabi Azad under the regime of UPA government, we discussed this issue, reminded him, "Sir, do you remember my request?" He said, "Mukul, I was Chief Minister of Jammu and Kashmir. I can easily understand your problem." Then we discussed. Then he called me to Delhi. Then we discussed again. He said it's a brilliant idea to leverage upon the existing district hospitals and referral hospitals, because these are already infrastructures available with every state. He came up with a cabinet memo. The union cabinet approved it. He informed me, "Mukul, I'm giving you one." I said, "Why are you giving me one? You know my problem. If I have one in eastern region, I have to have one in western region. You know the whole political dynamics of the state." He said, "Mukul, see, this has been already approved by cabinet. Cabinet has said that Meghalaya also should be given only one. I propose two." But the fact is that we were able to have a breakthrough. Now, to be able to convince government of India, and every state has benefited today. Look at the record. How many states have leveraged upon one after another. We are stuck with Tura Medical College, just one. Because after the change of the government, I don't know, for whatever reasons, the whole delay, the whole dislocation. I do not like to blame anybody, but then it is a fact. Why we did not pursue and complete? Because I promised my colleagues also at that point of time that after Tura Medical College, look at we will do in Ribhoy. We did share this. Today, Ribhoy, you have medical college from private sector. Ribhoy will not be eligible anymore under the eligibility criteria. Because the criteria says assistance of the union government to the states for establishment of medical college attached to district hospitals or referral hospitals in the districts where there is no government college nor any private medical college. That is the criteria. So therefore, this delay has not only, it's not a question of revolving around the issue pertaining to Tura Medical College. It's an issue which should be dwelt at length from the perspective of the benefit which should have accrued to the state if we would have known with utmost seriousness the need for expediting this program, this project, to complete on time. Now, another part which I want to share before the August House, to again remind us why this program, why this project, if implemented and established as government medical college, the state stands to gain. Disadvantages notwithstanding, disadvantages have been appropriately, exhaustively articulated by people who are protesting. The citizens, the members of civil society organizations, the students, medical students at large from all parts. Both Garos and Khasi Jaintia's, all Meghalaya medical college students are expressing their concern. Because we have to know, I would come to that aspect, but look at where we are missing. What is the program of this government of India? In addition to providing the assistance for the establishment of medical college attached to district hospitals and referral hospitals in the state, in the districts where there is no medical college, either private or government. What are the other benefits? The other benefits is that the government will continue to provide fund for strengthening and upgradation of existing government and central medical colleges to increase the number of MBBS, both undergraduate and PG seats. This is the benefit, extraordinary benefit, which will be accrued to the state. Because after establishment as medical college, it will be eligible for fund, for upgradation, strengthening, to be able to increase the number of MBBS, that means undergraduate seats, and also PG seats. Huge opportunity for our youth who look at this medical sector as one of the most, I must say, revered profession to serve our beloved people. And go beyond the boundaries of our state to serve others and come back with laurels. And look at another one. How Government of India has looked at all the likely challenges. Relaxation in the norms for setting up medical colleges in terms of requirement of faculty, staff, bed strength, and other infrastructure. This is a government policy decision. The NMC is guided by this policy. Because last time when the minister in charge were replying to my supplementaries, she did refer to the stringent norm of the NMC. But today, let this House be informed that the government of India has adopted this particular policy, knowing fully well the challenges of the states. Because the nation does require doctors. Not just the aspirational part of the students or the young men and women who would like to become a member of this medical profession, but at the same time, also the need to ensure that doctors are available everywhere. Just yesterday, Honorable Chief Minister has intervened when we talked about the doctors. Frankly speaking, the gap between the demand and supply is still huge. It will go on increasing. As we try to, reach that level where the access to quality health care will be at par with the rest of the developed world, which we are aiming at. We have not reached that stage. But we will have to aim big. We'll have to reach that stage. That's the reason why you require to weaponize these facilities, these programs of Government of India. How we have weaponized the externally aided projects. To see that the funds accrue to the state because of the initiative that we embarked upon more than 13 years back in 2012. So what has been built thus far? Leverage upon it and build more, and sky is the limit, because the aspirations of our youth, the young generation, will only go on surging. It will not be stagnant. Stagnation is bad. Therefore, stagnation is one of the reasons why we get all ailments. Dormancy. We talk about insulin insensitivity because of dormancy. Likewise, our activity in any sector, we have to see if we are stagnating, this stagnation is leading to dormancy. This dormancy, this stagnation has somehow failed the state to leverage upon these benefits. Therefore, it is important to take this advantage and be sensitive to the sentiments and emotions of our people as a whole. People of Garhwals think that this is something which has been given to the people of Garhwals. I remember how one small establishment, Meghalaya Board of School Education, was a bone of contention. Every time there used to be politics on Meghalaya Board of School Education, we overcame that. How? We collectively decided, let's once for all, the issue of Meghalaya Board of School Education be not leveraged upon by any adventurous politicians. And we came up with exhaustive measures, enacted the law, amending the earlier principal law, putting Tura as the headquarters in 2006, putting end to all those pulls and pushes, and the narrative which generated that, okay, somebody is trying to, shift it to Shillong, Meghalaya. All these things have been put to end. Therefore, this particular initiative is also designed to be established in those districts where access to healthcare have huge gap in terms of the hospitals available as referral centers. Today, we talk about the district hospitals and referrals. These are secondary referral centers. When Tura Civil Hospital is not able to treat any patient, what is the advice to the patient party? Either to either to Negrims or to other private hospitals in Guwahati. Because we are yet to have the tertiary referral hospital in that part of the state. Now, I would like to again refer to another benefit where the ministry also provided to enable the states to overcome any kind of challenges associated with establishment of government medical college, enhancement of age limit for appointment, extension, re-employment against post of teachers, dean, principal, director in medical colleges up to 70 years. These are available provisions, which are the concessions. We have somehow or other agreed on putting the retirement age to all the doctors at par with other employees. This is also one issue which should be examined. Because the best of the specialists, best of the doctors, when they are at the peak of their, I must say, brightest part of their career as a medical professional, they retire. And we'll end up having huge vacancy. The resultant retirement at a very young age, unlike other states. This is also one thing, I think it is corroborative, because Government of India has already included this as an integral part of this policy to allow the states to employ. So there are ways and means. And therefore, it is an opportune moment for the state government. I would like to urge upon the Minister in charge of health, take this opportunity. Be positive to the call of the people. Let us be responsive. We have hurdles, I know. We will share these challenges together. We will shoulder these challenges together. Because at the end of the day, what matters for the people must be our priority, nothing else. I know that Tura means Shillong, we have embarked upon looking at this need to establish the medical college. It is a milestone. It is an achievement. In fact, Honorable Minister of Health informed me about this. I say that it's a great milestone. It's a benefit of the endeavor that you have put forward along with the team. But at the same time, this should not be the reason for being incapable of going ahead with the original proposal, because then we'll end up losing all other benefits. In this program, Government of India also provide support for, again, strengthening the existing government medical college to establish super specialty hospitals. Look at this. This money you will be able to leverage upon only when we have the government medical college. Therefore, the pros are more than the cons. I would also like to link it with from another perspective. Bringing in private investor to place like Tura, a small town. Garo Hills as a region, it's not big enough. It's like bringing the shark into your pond. Like Gualmas, we call, Garos, we call Najek, bringing the Najek to a pond, fish pond. There will be no more space available for our medical professional in the years to come to look at this private sector in healthcare, providing healthcare facilities. They will be only the employees of these private investors, because the first mover advantage in any form of government, we all know what is the advantage of first mover investor in any field. So, in this crucial sector of health, how bringing in this private investor can really have serious ramification in the whole healthcare sector. It will derail the access to affordable healthcare. Affordable. Healthcare is there today also, but is it affordable? Well, one night the bill comes to 50,000, 60,000, 1 lakh also. I'm following up. Every day, I think all our honorable members of this, distinguished members of this August House must be all updated on this, because we all have our people who are in hospitals. Can you imagine? Somehow or other we have gone wrong in many ways, then therefore these corrections are required by creating these facilities, government-owned facilities, by which we can dislocate this trend of increasing cost of healthcare facilities, which is being dominated by the private sector. Otherwise, there is no other alternative. Yes, there is no other alternative. I have done exhaustive due diligence on this. I'm sure all of us must have done it, but we need to continue to engage and exercise our mind collectively. Share whatever we know. Because when I listen to others, then I know what I don't know. But if we don't want to listen to others, then we will know only what we know. So therefore, I think it is important to see that we share ideas, we share concerns. Certain things we, hesitate to do, we refuse to do because we know what is going to happen. We know what is going to happen. They are not coming for charity. The private entities, they are not coming for charity. So therefore, the access to quality and affordable health care has become a challenge. I actually cautioned the government after I exited the office about the Meghalaya Health Insurance Scheme, MHIs. Meghalaya being the pioneer. The Honorable Prime Minister wrote letters to all the chief ministers saying that Meghalaya has embarked upon this beautiful program for universal health care through very innovative health insurance program to cover all the citizens of the state. They may emulate. You are requested to examine and emulate this program. But today what has happened? This so-called smart card has become, something which has become a trap for the patient parties. You know how? Because we have not engaged with the hospitals to fix the rate. If we buy something, we have to ask the rate. If I'm paying, I should know what is the price. But we have only fixed what is the amount that will be covered by the insurance, but we have not asked the hospitals how much you will take. We did during our time. We fixed it. So initially when we had discussion with all the hospitals, government hospitals and private hospitals, what happened? When we fixed the rate, we looked at all the input costs, everything, and then therefore justified, okay, how much should be for an operation of appendicectomy, cholecystectomy, etc., etc. Then, keeping that margin of profit, which is considered reasonable, justifiable. Then many hospitals, we had to have repeated meetings after meetings, when some of the hospitals said that we are not willing with this rate. We said, okay. But others were willing, we partner. Then subsequently all others also said, because people with smart card went to hospitals which accepted this smart card. So eventually others also said we will participate. But then predetermined rate was agreed upon. I hope the government will again look at these MHIs also. That's why the cost of healthcare becoming inaccessible. People are surrendering to disease. Therefore, Mr. Chairman, sir, we can have thousands of reasons to agree to this proposal of the people of that part of the state. And challenges are there. I do not say there are no challenges. The Honorable Chief Minister have, to a great extent, articulated all those concerns about the salary. Now, I want to remind ourselves how we engage with Government of India. Over the years, government after government, and during our time we were able to prevail upon Government of India and the Finance Commission. Read the recommendation of the 14th Finance Commission. When the overall quantum of share of taxes transferred to state, as per the Finance Commission recommendation, was limited to 32%, which was increased to 42%, 10% increase. 10% increase. Collective endeavor of the states at that point of time. So this increase has come from 2015-16 onwards. Today the state is, when we approached the Government of India for all those centrally sponsored schemes, when we said it should be 90:10, like earlier government, we were told, no, you are flushed with money. You are flushed with money because the transfer of share of taxes from 32 has increased to 42%. This is the collective endeavor we have already put. You have to, as a government of the day, leverage upon this money. Therefore, there is no question of saying that there is no money. We had that problem where we had that 32% of the share of taxes when it was transferred to the states. But today, since 2015-16, because of our collective endeavor, the Government of India also agreed, the Finance Commission agreed, increased it to 42%. Plus, all the fund which is available through EAPs are able to take care of other things. And another thing, what are the terms of reference usually given to the Finance Commission by the Government of India? Whenever any deficit in matter of revenue expenditure is there, the Constitution provides that revenue gap assistance is recommended by the Finance Commission. The Finance Commission will go into details, the whole expenditure on different hats, and particularly on salary and pension hat. This is the constitutional provision. If you have deficit to meet that revenue expenditure, then the onus of responsibility is vested upon the government, based on which the Finance Commission recommends. You look at the quantum of revenue deficit grant given to other states who had a huge deficit. Ours were less. So one day I was confronted. Why our revenue deficit grant is less? Because we have more revenue. Why Nagaland had 7,000 plus grant for revenue deficit? Because their revenue deficit was more. So this is how the provision of the Constitution operates. We don't beg. I have mentioned earlier also, we don't beg. We go for our entitlement. I'm very happy, last Assembly budget session, the Honorable Chief Minister also said the same thing now. We don't have to beg. It is our entitlement. Therefore, if there is a shortage to meet the salary, you have no problem. You will have a hiccup initially, like your battery not igniting, so somebody pushed, you go, reach the destination. That is how the constitutional provision is provided in this vibrant constitution. They have already taken into consideration all these challenges, because in this diverse country, the framers of the constitution, knew how the states will be confronted with challenges, particularly in terms of resources. That's why this whole mandate, every single paisa that Government of India transferred to the state is all mandated by this Constitution of India. Nothing else outside the Constitution of India. Nobody can do this, because there is no charity that anybody can do, nor Government of India can do any favoritism. All those other grants are coming as also covered by this mandate of the Constitution. Therefore, the issue justifying that salary will be around close to 100 crore, it will be. Initially it will be a little less, but I would like to urge the government, when going gets tough, the tough gets going. So let the government assume upon itself this very principle. It is tough because we are not, state with huge resources. We have constraints. But the whole focus and priority should revolve around the interests of the people, which should be considered with utmost sensitivity. And in this regard, look at which is the area which is considered as difficult reason to have access to quality health care. Anything to do in deviation of the earlier intent of establishing Tura Government Medical College would only land up in creating unending suffering to our people and will land up in many negative ramifications which will be visible in future, for which we will be blamed. So let we give all that we usually say our best to see that we take cognizance of this as our collective responsibility, and what was considered as due for somebody, it's like children. If we give something to a child to play around, one toy, you take it back, the child will cry. So I think this explains everything. So therefore, I urge the government to see that Tura Medical College is established as a government medical college. Many other things we can discuss, and I have discussed with the Minister in charge of Health. She has said she would like to discuss further. We are always available to discuss and see how we can put our efforts and funnel it together to achieve the objective. With these few words, Mr. Speaker, sir, with all hope and expectation and trust and confidence, I make this submission in the best interest of our people. Thank you, Mr.